104.8, it is Channel 4. You got Sean here hanging out, and we're going to talk about something that is very important, especially as you get older and older. And I'll tell you what, we are all aging every single day. We're going to talk about knee osteoarthritis because it is something that can creep up definitely in your older age. And here to tell us all about it is Dr. Mustufa Pervez Khan. He joins me this afternoon. Doctor, good afternoon to you.
Good afternoon, Sean. How are you doing?
I'm doing well, but this can be a little bit scary, especially when we get older. Now, talk to me a little bit about knee osteoarthritis. How common is knee arthritis? And can you explain to us what it actually is?
Yeah, sure. So knee arthritis being one of the commonest arthritic conditions that you get as you slowly age, it's usually more common in females. So around 16% of females and around 10% of men who are above the age of 60 usually do get this knee arthritis. And if you just put it simply, it's basically the gap between your thigh bone and the shin bone, which is the femur and the tibia. It progressively decreases and starts rubbing against each other, and you start having inflammation and pain. Like in simpler terms, this is what arthritis is.
Now, can you explain some ways that we can prevent this and even delay the disease progression?
So a lot of it has to do with cultural aspects, also genetics. A lot of factors play into it. In the Asian culture, we have a lot of sitting on the floor for prayers, for eating food. So that kind of makes us more, enables us to have this arthritic progression more and more. So one thing that needs to be done is making your knees strong. That is by doing quadricep strengthening exercises, trying to sit less on the floor, trying to lose weight, being just generally healthy and active. That plays a lot of role in delaying the progression or even not having arthritis at all.
Okay, doctor, stick around there because I do have some more questions for you. I want to find out if people are already too far gone, if there is treatment and what the best way to go about that is. Are you cool to stick around for another 5?
Yeah, sure.
Okay, Dr. Mustufa Pervez Khan is going to join me right after this at Channel 4. 104.8, it's Channel 4. It's Sean here hanging out with you this afternoon, and we have a very important man on the phone right now, Dr. Mustufa Pervez Khan, and we're talking about the important topic of knee osteoarthritis. It is very common, we just learned, among women, especially over the age of 60, less common among men, although it still happens. Now, we want to know, doctor, what are some treatment modalities for knee osteoarthritis?
See, the knee arthritis, we can classify it into grade 1 and 4. So a lot of the treatment option depends on what stage you are at with the arthritis. So if it's in a very early stage, the treatment modalities usually consist of taking pain medication management, trying to strengthen your knee by doing exercises, doing some icing to your knee, and a little bit of physiotherapy helps as well. If you've tried everything and your disease is progressing, let's say you're at grade 2 or 3, sometimes PRP injections or cartilage injections, they usually help as well. But ultimately, if your knee is completely gone and you have grade 4 arthritis, then the last ultimate option is getting a total knee replacement.
Okay, now that sounds scary to me, and I'm sure that sounds scary to a lot of people. Could you just explain a little bit what exactly is a total knee replacement, and is it a bit more common nowadays that with the modern medical equipment and stuff?
Yeah, precisely. So total knee has become one of the most successful surgeries in orthopedic these days, and one of the most common as well. So once the joint surface and everything is completely kind of destroyed, so there's nothing else you can do, none of the injections, and if none of the painkillers are working, then you have to get a replacement, which basically means we cut your bone into a particular shape and we put in implants and man-made polyethylene spacer between the joints. So it basically becomes a new joint, which is kind of artificial, but it allows you to restore your walking. It gets rid of the pain and your walking improves and generally health improves because now you're able to walk better, you're rid of the pain. So that's what total knee replacement is.
Fantastic. So I think the main message here is that if you're struggling with knee pain, there is lots of options out there, including no matter how far gone you are, that you can go straight up to the knee replacement. You start with the stretches, and if it gets worse and worse, then you end with the knee replacement. Is that right, Doc?
Definitely. Medical science has improved so much that there are treatment options for a lot of things, and especially knee arthritis, it's something that we can tackle.
Fantastic. Dr. Mustufa Pervez Khan, thank you so much. I feel a little bit better about my knees now.
Thank you for having me, Sean.
Absolute pleasure, mate. It's 104.8, Channel 4.